right after we look at the numbers. Thank you for joining, and we will try to remain within the hour and a half maximum time frame. So I'm going to move right into what our current status is for today, the 20th of May 2020. So I want to begin by indicating that we have had the highest number of recoveries to date in the last 24 hours. Recoveries have moved to 171, up from 145 in the last 24 hours. This 171 means that we have had 26 more Jamaicans recovering from COVID-19 and therefore would have been released back to their communities across Jamaica. The recovery rate, therefore, is improving, moving in the right direction. It now stands at 32.3%, and that is encouraging news, and we certainly wish those persons all the best, and again thank the medical team that have been giving them support during the period of their positive status. Our deaths remain the same, 9 or 1.7% of total those who have been affected or infected. That 1.7% is well below the global statistics, global numbers, which was around 2.6 to 3% or thereabouts. And so as a country, we are doing better than most, and that again is worth celebrating, even while we regret any loss of life. I would further state too that based on an issue that was raised in the Special Select Committee and in the Parliament yesterday, that there is no, well, let me put it another way. Deaths in the first 3 months of this year, when compared to the first 3 months of last year, is actually lower based on RGD statistics. Indeed, in the month of April, is it March or April, there were some nearly over 300 less deaths. And I raise that to say that those who are concerned about testing and whether we are losing Jamaicans to COVID and not picking that up because we may be not testing enough persons, that is not demonstrated in the statistics as it relates to overall deaths. We're not losing more Jamaicans since COVID has come on the scene. In fact, the statistics suggest that less Jamaicans are dying. And clearly we're not making the link to less people dying to COVID. But what we're saying is that the argument or the criticism that we may be under testing and therefore not accounting for the deaths is not one that the evidence supports. And I want to make that very clear. Meanwhile, again, encouraging news, there are no seriously ill cases of COVID-19 on the island, despite the numbers of positive persons testing positive. This means that persons who are in hospital care are not severely ill. They're not in high dependency units, and they are not in ICU units, intensive care units, that is. Most are asymptomatic, and for those who need treatment, their symptoms are relatively mild to medium. And that again is worth celebrating. We will continue, of course, to provide medical care to those who need it to help our Jamaicans to overcome the COVID challenge. 9 new cases of COVID-19 have been confirmed for Jamaica in the last 24 hours. So our numbers have jumped by 9. This puts the total number of confirmed cases on the island to 529. The new cases range from 17 to 53 years, and so the COVID spread is affecting age cohort across the board, and that means our response has to be to address all age cohort. 6 males recently repatriated from the United Kingdom, another important piece of information, are among the new cases, the 9 new cases. And I want to pause here to say that of the total number of persons who have come in from the UK, we have so far had confirmation. This is just over 100, right? 120 or thereabouts from the UK. We have had positive confirmation for COVID of 12 of these individuals, and all 12, as I understand it, are former crew members of a particular vessel that came into the island on that flight, which means that of the total number of crew members who came in, which totaled approximately 46, 26% have tested positive for COVID. And it raises an uncomfortable issue, which from a public health perspective I have to comment on, which is that we are sometimes blamed for being overly cautious, but there is sufficient reason for us so to be. And it's not to accuse anyone of anything, but it's just to represent the best public health interests for the general population. Because one could argue that the arrangements that were made prior to these persons coming in had involved quarantining and testing, but the reality, having come in, is that 26% or 12 of 46 have tested positive. Now it is our duty or obligation to give all the support to these individuals. They are Jamaicans and we have an obligation to give them support, as we do all Jamaicans. But the COVID risk that we face does require us to represent all of Jamaica, including the general population. And so we have to take the necessary precaution. And I think the reasons are clear as manifested in the statistics that I've just announced. Otherwise, apart from the 6 who are linked to the repatriated persons from the UK, 1 male employee of the workplace cluster in St. Catherine tested another positive case, 1 male contact of a confirmed case from the workplace cluster in St. Catherine, and 1 male from Kingston and St. Andrew is a contact of a confirmed case on the investigation. So 6 linked to the UK persons coming in, 2 to the St. Catherine cluster, and the final of the 9 on the investigation. In terms of classification, there are now 234 confirmed COVID-19 cases related to the workplace cluster in St. Catherine, 50 imported cases, 206 cases that are contacts of confirmed cases, 26 that are local transmission cases not epidemiologically linked, and 13 that are under investigation. Some 317 or 60% of the confirmed cases are females, while 212 or 40% are males, and the cases continue to range across the age cohort from 2 months to 87 years. On testing, we have 492 samples that were tested in the last 24 hours. That's 492 samples. 193 of those new samples and 299 discharge samples. Discharge samples, of course, meaning persons who have served their quarantine period and have done their second test, and based on the results of those tests, they would be either discharged or held on to, depending on whether they're positive or negative. The 193 new samples tested for COVID-19 bring the total number of samples tested on the island to over 9,021. Of that 9,021, in addition to the 529 positives, there are 8,420 negatives and 72 pending. So that's it for the statistics as of today and the last 24 hours. we're going to be looking at what could be the most topical COVID-related issue current now, and that's the issue of the vessel that is now in port in Trelawney, where tomorrow morning, given that all the necessary pre-arrangements are to be completed this evening, we will begin to take off in 200 batches the Jamaicans, the over 1,000 Jamaicans that are on board. This was always the case, and we want to use this opportunity just prior to the questioning to explain with 2 slides what the process will involve. And I'm going to ask the the Chief Medical Officer to just run through quickly so that the population or those listening on can have an appreciation for the process.
Right. Good afternoon, everyone. Okay, just to run quickly through the process. The process starts with the Ministry of National Security giving approval for the exemption to the closed border rule to allow this vessel to come into port. We have a process that we carry out for all vessels that are entering the country, that they submit a list of information that is requested on the crew, on the ports that they have come in from, the persons that are on board the ship, and whether there is any illness on the ship and the general situation on the ship. Once those documents meet our approval, and that is submitted to our port health staff, and once it meets their approval, then the ship is allowed to come into port and for us to board. Now, we have delayed the boarding of the ship for a day because the ship came in yesterday, and we delayed the boarding until today in order for us to finalize all the arrangements that needs to be in place to process the persons that are coming off, ensure that there is accommodation, transport, all the logistics are in place for them. Today we went through the process where the medical officer of health boarded the ship, and having done the inspection on the ship, we would have issued it is
Just need to come up closer to you. Is that okay?
okay from the top. All right, the process would have started with the Ministry of National Security giving approval for exemption to the closed border rule. Once that was done, the ship is required to submit a certain amount of documents that looks at the crew and the passengers on the ship, whether there's any illness on the ship, and if there are any incidents during the passage of the ship, where the ship is coming from, and all the ports that it has called at. Once that meets our approval, and that initial approval is based on the fact that we don't think that there is any illness on board the ship. Once that meets our approval, then the ship is allowed to come into port. The next point would have been that we would have boarded the ship to do an inspection for ourselves, but we delayed that for a day because we needed to make sure that there were certain things in place to ensure the smooth processing of persons when they come off the ship, and to have the facilities ready for them at the hotel to also ensure that there's monitoring in place. Today, yesterday when the ship came in, the documentation that was provided did indicate that there was a sick person on board, and arrangements were made for that person to be transferred to the Cornwall Regional Hospital. So that was done yesterday. This morning, the medical officer of health for the parish of Trelawney boarded the ship and did inspection with the port health staff. And at that point, in recognition of the fact that according to the Quarantine Act, some of the rules there states that if a ship is coming from a port where there is infection, then the ship would be held in quarantine. So that means that we would not grant permission for persons to disembark the ship freely. The ship would not be granted pratique. That is a word that we use, and the ship would have been held in quarantine. So quarantine orders were placed on the ship, which means that no persons would be allowed to disembark the ship for the next few days while it is that we carry out the necessary investigations. However, in the processing, in order to get the Jamaicans to disembark, we made certain stipulations in terms of the quarantine orders that were placed that would allow the Jamaicans to disembark over a period of days in batches of 200. Many persons are concerned about the fact that we're only allowing 200 persons to come off, and I've seen questions where persons are asking if it is that we have the capacity to test over 1,000 persons per day, why not test everybody per day and allow persons to come off? However, it is not just the testing that has to take place. We do have to go through a process where persons are interviewed. We do get the paperwork, but we do have to do a personal interview as well to ensure that everything is in order. We have to do some sensitization of persons. We know that a big part of us being able to control what is happening in Jamaica in terms of spread has been because of public education programs. And so we want to ensure as well that these persons, during the interview and after the interview, that we provide some information about COVID-19 and also about what is happening in Jamaica and how it is that we prioritize certain actions, why it is that we have to put them in quarantine, what would happen that would make them go into isolation, for them to generally feel comfortable with the process that they are entering into. So once the persons come off, and that would start tomorrow. So today they are being processed by PICA, and PICA would go, that's PICA is the immigration agency and customs agency. They would go through their process today for 200 persons, and tomorrow we would be ready to start the disembarkation of those 200 persons. Once it is that they come off, they will be sampled. The samples will be collected from them, and then quarantine orders will be served, and they will be transported to a quarantine facility where they will remain for 24 to 72 hours until we get back their results. When we get back their results, then arrangements will be made for home quarantine for these persons depending on the results. If we have persons that are positive, then of course these persons will be isolated. Considering the risk that there will be in having persons in home quarantine, we will do quite a bit of sensitization with the persons once they are at the hotel, for them to understand their personal responsibility as well. And we will enter into an arrangement where they will be monitored for the period that they're going to be at home. The next 200 persons will disembark on the following day, and the same process would occur. And we go through that process until all persons have disembarked and have gone through sampling and have been released into home quarantine.
Thank you very much, CMO. So there you have it. That's the process that we will work with to complete the processing of the over 1,000 Jamaicans on board the Adventures of the Sea, Royal Caribbean. We are obviously working with the other critical agencies, Ministry of National Security, so it's Customs, Immigration, Port Authority, which falls under the Office of the Prime Minister. And it's a collaborative effort. But from a public health standpoint, the collecting of samples, the quarantining, the testing, and then the home quarantining or isolation represents the substantial function of public health. And I want to thank the team because they've been doing a lot of work to make this happen. Just to say, we are going to go into questions now, but prior to, after the questioning, I'd like you to hold on because we're going to be interviewing an executive of Adventures of the Sea who is currently on board the vessel, He is the hotel director. That's his title. And guess what? Even though he represents senior management, he's a Jamaican, and he's actually not going to get off the vessel. He's working and helping to manage the process there, and we'd like to get his perspective. We also will get a quick update on Bahe Principe from the operations manager there, whether things have adjusted. Bahe Principe will be the home for a number of these persons coming off the vessel, and as you know, we had some issues there. And in keeping with the announced intention not to renew the work from home order, we wanted to quickly speak to a business operator who employs a lot of persons to get a perspective on what they think living with COVID really means from a workplace perspective. So we have 3 quick interviews which hopefully can provide some better insights behind the numbers that we have just announced. So we'll move now into the questioning. Stephen.
Thank you very much, Minister. Just reminding our media colleagues to use the raised hand feature on Zoom. We're going to take 2 questions from Andrea Chisholm from TVJ. She is asking, I've heard reports of a pregnant woman who was on the ship, aboard the ship, Adventures of the Seas, which docked in Jamaica. Can you first of all confirm if that was the case, and if so, what is the status of the woman and her baby? The second question, we have received reports of some Jamaican ship workers being traumatized by recent events, including the prolonged isolation on the ship. Are there any plans to offer any form of psychosocial support?
I'm going to ask the CMO to just quickly address those 2 issues since they're clinical.
Right. So, yes, it was in fact a pregnant patient that was removed from the ship yesterday, and that person was transported to the Cornwall Regional Hospital. The particulars of the case are not available for discussion at this time. In terms of the psychosocial well-being of the persons at the different quarantine and isolation facilities, we have been working with our mental health team to put together a program for these persons. We have had some improvements in terms of the activities planned at the existing facilities, and we continue to offer that support in terms of offering any kind of counseling that is needed. I must say that for the persons that are coming in on this cruise, we have also made arrangements for this to be done in terms of any counseling that is needed.
Thank you very much, CMO. We're going to go to Arthur Hall from The Observer. Go ahead, Arthur.
Minister, I'm not sure if this is you or the CMO, but we're understanding that emergency case that came in yesterday, that lady has lost a child. Can you or the CMO give us an update on that?
No, we're not able to give you an update on that.
And let me just explain, Arthur, that, and I know you appreciate this, the patient confidentiality issues doesn't allow that to take place. The person would have to speak on their own behalf as it relates to the status of their condition, or give written permission for that to happen.
Thank you very much, Minister. We're going to go to Jamaica Social.
Hi, good evening. I'm Cassius Watson for Jamaica Social. 2 questions, one to the Minister and one to the CMO. Minister, your thoughts on what you observed or what your people in the field observed from the reopening of bars and churches on the weekend. Are you comfortable with what you saw regarding social distancing, sanitization, and all, as well as to the CMO? There is word coming out of Asia of people being reinfected with the virus just a couple of days ago. Have you been seeing those reports, and any thoughts on that? Thanks.
So let me take the first question. I have no reports to date on the um, the bars and churches reopening and the extent to which procedures have been observed. Well, actually, on the churches, the Honourable Prime Minister did speak on Monday and indicated that the reports he has been getting is that the churches have been observing, for the most part, the protocols. The bars, I think, opened yesterday. Was it yesterday, Monday? So Tuesday. So maybe early days. I think in the coming days we will have a better appreciation for what the status of that activity is. We have spoken to a few persons. I had one on the discussion last Wednesday, and the impression was that there were attempts to comply, but I guess the time will tell over the next few days.
Okay, in terms of reinfection, I just want to clarify between reinfection and positive test once persons have recovered, because the positive status does remain after a while after the person has recovered. And so therefore, as you know, for Jamaica, we follow stringently 2 negative tests at least 48 hours apart before we say that there is a negative test. And even after that 2 negatives and we discharge the patient, we maintain monitoring of the patient for 2 weeks further, which includes an interview at the end of the 2-week period, and if necessary, a resampling. The reports of reinfections and repeat positive tests after persons have recovered, we have seen that for quite a while. Certainly we've seen the latest reports out of South Korea, and for some time now we've seen reports out of the UK of that happening. And again, there is uncertainty as to whether, and most of those have been positive tests that have occurred after the persons have been said to be recovered. And so we cannot say that those are reinfections. It could be the same infection, but the positive tests do remain after a while. And sometimes you may get a negative test and then you test after and you get positive because of various reasons. The virus load is going to be very low at that time, and sometimes sampling initially may pick up a negative test, but then when you resample you can get a positive test. Sometimes it is also as a result of how the test is done. If the test is not done properly, then you may not pick up virus on that first sampling that gave you a negative test. Hence the stringent approach to us giving a negative test and or discharge criteria and protocol. In terms of reinfection of the person, now this means that the person would have gotten rid of the virus totally from the body and now would have had a new infection. There has been just several documentations that we are not sure as to how long any kind of immunity that persons have last for. We are hopeful that it will follow the patterns of other coronaviruses, and certainly of SARS coronavirus 1, which lasted for a long period, but we are not sure at this time. So there is, at this time, I must say that yes, there is the possibility of reinfection because we do not know. But for Jamaica, we are still early in the process. And what we are seeing from our positive cases is that it is taking upwards of 3 weeks, sometimes 4 weeks, for persons to become negative. We are also not sure at that time, in that last part of the positive results, whether or not persons are infective, because sometimes you can have viral particles that will give a positive test but may not necessarily be infectious. So there's still a lot to learn from the infection, and so the necessity of a cautious approach.
Thank you very much, CMO. We're going to go to Brittany Clark.
Hello, good evening. Okay, I have two questions. Firstly, there are some lingering concerns about the home quarantine measures. What sort of technology is in place to monitor those persons who are expected to be placed in home quarantine? And is all the technology in place for the process tomorrow? And if there is no technology, how will the ministry ensure that these persons abide by the home quarantine guidelines? My second question is to Minister Tufton, regardless of the fact that the government is now making strides to restore the economy, do you believe, rather, the wearing of masks will form part of Jamaica's new normal in the long term, or at least in the foreseeable future? Thank you.
Okay, so in terms of the home quarantine arrangements, clearly it is a less controlled environment than if one were in an institutional setting. So there's no doubt that it comes with greater risks for persons and depends, therefore, to a large extent on persons engaging in discipline and taking personal responsibility. The reality is that in the future, home quarantining will become more the norm than the exception. And in a sense, we are gradually moving in that direction, and we're going to have to get the society to come to terms with the need to protect themselves, their best interests, the protection of their family and friends and their community, and by extension, collectively, the country. So it does come with risks, and it's going to depend a lot on individuals, the persons. The technology that will assist the process, however, the monitoring that is, will begin with our Jamaican Gov't app, which will be placed on a smartphone and will require that individual, in keeping with taking personal responsibility, to provide periodic updates in terms of temperature checks and so on. And we will have to depend on individuals to be faithful to the requirements that will be placed to them as a condition of them going home. Beyond that, though, in time to come, we intend to deploy another technology device that would be more secure in terms of affixing it to the individual. And if that individual were to move out of a particular space or tamper with the device, then it would provide a signal to the monitoring infrastructure to respond. That is a more secure arrangement, but that is in train and not yet available. So for now, it's really the arrangements on the Jamaican Gov't app, and it's going to require a lot of personal responsibility. Okay, go ahead.
No, I just wanted to make add some particulars about the app that speaks to why we think that the technology, while we agree with and we support the whole action towards personal responsibility, the app will have a geofencing feature in there that pings the person in a specific location every 30 minutes. If the person is outside of the area of the geofencing, the ping will alert a central point where the JCF will be alerted to the fact that the person has moved out of the specific geolocation. All persons who will disembark will be asked to give consent to their being tracked in this way. The app will also, at random times during the 14 days, send you a text, at which point in time you will need to make a video call on the app, and then it will identify your location, and it will ask you to certify certain information at that geolocation.
Thank you. But again, the personal responsibility cannot be overemphasized, because if it's a phone, it means that you have to have the phone with you for you to be geofenced. One could be creative, and the phone could be one place and the individual another place. So while the app does work and is an effective tool, it definitely requires the personal responsibility. The other device would be more difficult for one to separate oneself from the device, which is why we're making arrangements for that device. So there are some risks, that's the point. But we will depend on the faithfulness of the individuals in their own interests to move the process forward. The other issue of the masks, it's difficult to say. Personally, I hope this is not the case. I can't tell you I enjoy wearing a mask. I like to feel free. I like to enjoy the freshness of the air and the flowers, and the mask can be quite challenging. And secondly, improper use of the mask can become a health hazard also. So while the masks do serve a particular purpose in a particular context, to the extent that we have this threat now, we certainly hope that in the future the threat will be minimized as modern science catches up with the risk and neutralize that risk, and therefore the need for mask wearing on a long-term basis may not be as important as it is now.
Thank you very much, Minister. We're going to go to Damian Mitchell.
Thank you, Stephen. Minister, can you say whether the request or why the request from Adventure of the Seas for medical evacuation by helicopter was not honored? That's my first question. And then my second question, is the health ministry still going ahead with the field hospital at the National Arena in light of an apparent change in Jamaica's response to the coronavirus? And I may have a follow-up depending on your answer to the second question.
First thing, I'm not sure of the assumption that was made earlier as it relates to honoring a request for airlifting of the patient. As far as I'm concerned, once the request came in, the request was dealt with. The CMO may want to comment more on that, but I don't recall being part of or being advised. Not a matter of don't recall. Let me not use that term. I was never advised that there was any request and that the request was denied. So I suspect it would be a matter of processing the request and following through. And a lot of events took place during that period which led to the person being given the appropriate attention. That's my knowledge of it, unless the CMO wants to add any additional information. Is there anything else that you want to add to that?
Well, I just want to say that there was information spreading before we got an official request for medical evacuation, and the time at which we received the information, the evaluation by both the persons on the ship as well as the persons on island, I gather the information that I have was that the condition of the person would allow for the ship to reach here safely. Of course, it is always a medical evacuation itself comes with risk, and one has to weigh the importance of what is the intervention that would be put in place, that needed to be put in place immediately, that would warrant the evacuation. And on review of the medical report, it was agreed that the person, the condition could have was stable enough to allow for the ship to arrive and for the safe disembarkation of the person.
Thank you, CMO. The other question, I don't think I've heard one of the questions. I recall one of them. I remember the one about the field hospital. The field hospital is a matter of discussion, even though we have gotten the green light to go ahead. And a decision will have to be taken. We have been discussing it internally. But let me just explain what the sort of internal conflict is around the hospital. First of all, we don't want to build a white elephant, something that we spend money on and it not being used over time. At the same time, we are concerned that as we move to a life of living with COVID, opening up our borders, allowing free movement, the risks that are associated with the spread of the virus, at least in the medium term, will be greater. We're seeing evidence of that in terms of the controlled re-entry, where we have seen a number of persons testing positive. By the way, it's 15 of the initial numbers coming in, 3 from the US and 12 out of the UK, so 15 overall. The challenge with that, of course, is we're going to have to prepare our secondary healthcare system, and we are doing that. We're putting over 300 beds, wards, to deal with COVID, but we have deprived other areas of servicing health-related areas to put in these wards. Some we have added, but some of existing that we have converted. And the real issue, Damien, is, are we likely to be overwhelmed at some point? And should we put an infrastructure in place to manage the process over the next 6, 8 months, 12 months, as we are doing with community health aides at the primary level? And if we don't, will we become overwhelmed? If we do, will it be used or not used? And it's a very difficult decision to make, and that is what we're contending with now. It's not that the monitoring has changed, as you suggested in the question. It's not that we're moving to home quarantine, because that was always on the cards, because we can't institutionally quarantine persons for an indefinite time. It's very costly, by the way, and while you'll have a limited capacity to do that for special arrangements, special circumstances, what we're more concerned about is the capacity of the secondary system to respond should you have a surge. And the chances of a surge are real when you open the economy, and whether or not the existing infrastructure can deal with that. So that's really the issue as it relates to the field hospital, why it is still under consideration, even though we have the go-ahead to do it. I don't recall what the third question was.
Thank you. I was saying I would have a follow-up to it dependent on your answer to this question. And in fact, there is a follow-up. So if you should abort the contract you had initiated with Rogers, how much would it cost the government?
Nothing. The question is whether or not, I'll tell you what I mean, we're transparent. I'll tell you what I've said to the team. I've said, listen, maybe one of the things we should do is look at the existing contract or arrangement in terms of expenditure, and look at a existing hospital and see if we could add a facility to an existing hospital space, so that after COVID you still have the facility, as opposed to going to the national arena, building out something that you may have to dismantle over time. It may still that is the consideration, but you won't lose anything if you abandon one approach for another, or if you abandon it altogether.
Thanks very much, Minister. There was a follow-up from Arthur. He asked if there was going to be an order in which we're deciding how the 200 persons will disembark from the ship.
Right. So in conjunction with the ship's personnel, they have identified persons who we would have considered to be of higher priority in terms of persons who have any kind of medical illnesses or any kind of personal situation that would warrant them getting home quickly. So we have identified those persons, and those persons would be disembarked initially. So those are in the first 200 that we would start the process for tomorrow. Now, subsequent to that, we are looking at logistics issues in terms of movement of persons who may come from, for example, the same parish. Because, as you know, we would be transporting these persons or making the arrangements for the transportation of these persons home as well. And so we have to work out with our partners what are the best logistic issues in terms of how it is that we batch persons. And one of the things that we're looking at are similar locations and batching with respect to that. That has not been finalized as yet, but we are working on that process, and it would be really to try to get the task done with the least amount of disruption or bother then to the persons that are involved.
Thank you very much, Simo. I'm going to go to Akira.
Good evening, Akira Davis here from the Star. So as we would have known, the CDC had informed that the coronavirus can spread via contaminated surfaces. But today, they shifted their stance to say that the virus cannot be contracted via such surfaces. What does the health ministry has to say about this? And my second question is, as we move towards the reopening phase of workspaces, what is being proposed for office spaces with air conditioning units?
I'll take the first question, and then perhaps you could repeat the second one. With regards to the information that is available on the virus, we still maintain that the spread of the virus is through droplets, and therefore logically the droplets can fall on surfaces and therefore can pose, for the period of time that the virus remains alive on those surfaces, then persons can pick up the virus and transfer them to their respiratory passages and cause infection. So that is not just for this COVID-19 disease, but for all infections that are droplet borne, the same thing applies. So we maintain that. You could repeat your second question.
Okay, thank you. My second question was, as we move towards the reopening phase of workspaces, what is being proposed for offices with air conditioning units?
I wouldn't try to answer that in general, because I think each workplace would have to be assessed by the persons that operate the workplace using the Ministry of Health's workplace policies to guide them. So you may have air-conditioned situations that are quite okay because you have adequate spacing and you have all the other infection prevention and control measures are applied, and so the workplace in itself would be safe. We do not consider that the disease is airborne, although in closed spaces it is possible that droplets, we have seen in various case reports across the world that we have had incidents where droplets have gotten into air conditioning vents and have moved because of the air that is pushing the droplets. So you, and in one situation you may have a condition that is fine and that allows for safe working, but in another situation you may have a lot of persons working in a small area that is air conditioned, and the infection prevention and control measures cannot be maintained, and that is where the risk is. So persons who are operating businesses, we are working in conjunction with the PSOJ and with various entities to finalize the workplace protocols, but the Ministry of Health's existing policies are on our website that employers and business owners can look at to have guidance in terms of what they need to put in place to ensure that their workplace is safe or is operated safely.
Okay. Thank you very much, CMO. We have a question from Emma Lewis. She's asking, can you please tell me how many care homes have been inspected to date and whether care home residents are being tested?
We had a presentation at the Special Select Committee yesterday where the Standards and Regulations Division actually presented on care homes, and it was a comprehensive presentation. I don't have the details in front of me, but just to say that there is a protocol as it relates to COVID preparation for these nursing homes. That protocol has been sent out both to the registered and unregistered nursing homes, and there is inspection taking place as we speak as it relates to the numbers, based on the numbers that are there, and they're well advanced in the process. I would need to get the details. Sorry. Okay, the detail is brought up here. So there are number 187 on record, numbers with, look at the numbers inspected. I'm just trying to find the data on the numbers that are inspected. Okay, I'm not finding it here, but I can share that information with her later on. But there was a fairly comprehensive presentation, and they are being inspected. That's the most important thing, including those that are not registered.
Thank you very much, Minister. We're just going to go to our final 3 questions. We have Suzelle.
Yes, good.
All right. Go ahead, sorry.
Okay, yes, good evening. I have a question. I couldn't help but realize that less samples are being tested in the 24-hour period as seen in the earlier stage of the outbreak. Is it that there isn't an urgency for more samples to be tested, or is it that less persons require testing, being that we have the capacity to test up to 1,000 per day?
Okay, well, first of all, we can test more than 1,000 per day, and in the last 24 hours, we have tested 492, which does not represent less sampling. It's actually relatively consistent thereabouts. So we are collecting as we go along, and it's been working, I think, based on all the other variables. There is a point at which we will have to do more mass testing, and that's a protocol that is being developed. On the issue of the nursing homes, I just found the information. A total of 118 have been inspected, 85 satisfactorily, and 33 to do more work. And so of the total number of 187, 118 so far, and this is in regards to the COVID response. Thank you.
Thank you very much, Minister. We go to 18 degrees north.
Good evening, everybody. Zara Burton. I am asking about the telethon and the PSOJ funds. Can the ministry comment on how much they've received from the telethon that occurred so far, and also the PPEs, protective gear, that was supposed to be purchased? What's the status of that from the telethon, and also even from the PSOJ? And is it possible just to get like a full-on explanation or a list or something that we could look at versus, with the donations and how the money's been spent and stuff?
The ministry has gotten support from a number of organizations. We've tried to give those that have contributed a photo op. You would have seen some of that covered in the press, in the media. As it relates to the specific 2 events that are entities, there are some discussions taking place currently with the ministry that Minister Grange and her ministry that organized the telethon, and there's still a lot of work to be done, and therefore we're not losing anything by not spending those resources as yet. So we'll keep you updated on that. On the PSOJ, it depends on how you interpret the PSOJ. I mean, a number of private sector companies have actually contributed to the COVID fight in one way or the other, including giving personal protective equipment, food items, and so on. The PSOJ as an organization to date have been working on a program that they have driven, and the expenditures that we have taken on up to this point does not involve any funds from the PSOJ as an organization, but many private companies, and I want that distinction to be very clear. But they have done their own thing. They've launched a program for vulnerable communities, and they have consulted with us. We've had some discussions. I've spoken to a number of the members and the president, Mr. Keith Duncan, but no resources have changed hands between the Ministry of Health and the PSOJ.
Thank you very much, Minister. We're going to go to our final question from Damian Mitchell.
Thank you for allowing me again, Stephen. Minister, can you explain when this Alorca call center worker you just reported has returned positive finding, when this worker was tested? That's question one. And can you confirm that a further 2 workers from the ship, the Morella Discovery 2, were tested positive today?
I can't answer the question about when this call center person was tested, and I'll allow the CMO to comment on the other question.
Right. So in terms of the testing of the Alarica worker that has tested positive recently, you would recall that we place persons in a 14-day quarantine period. And we do that because we believe that persons may be in an incubation cycle at the initial testing, and so they would have had a negative result. However, the incubation period continues for 14 days, and so during that period of time, they may become positive. So we would be retesting quite a bit of persons who had an initial negative test, especially those persons who we thought would have been at a high risk of having had contact with positive persons or several positive persons, especially within the workplace cluster. So some of those retesting are being done now, and while it is that we have closed off on the initial testing results, the initial tests that were done and have reported a certain amount of persons that would have been positive, we are now in the retesting phase, and so you may find that we will be coming up with more positives coming out of the Alarica case investigation as a result of this retesting. Right. We have to be very careful how it is that we speak about results that are just coming off the system, because we would not have been able to do the investigations to find out exactly who these persons are. So we would not have been able to make that report because we have not verified where the new cases are coming from as yet, because I would want to point out that we have persons from different areas that may have been at same facility. So I would be very careful of giving that information, and until we are sure of that information, then that is when we will be able to furnish that to the public.
It is unfortunate though, and I have to say that information is in the public domain when there's a process that has to be observed and respected in order to maintain the integrity of that process. So I hope that, well, let me leave it at that. As soon as we have the information, we validate the information will be made public, and we should respect the process to deliver that information, because it's important for the credibility of that process. And I think we've been very transparent in what we have done to date. Next.
Thank you very much, Minister. We'll do a final follow-up with 18 Degrees North.
But you're ahead of the game because let me tell you something. I've been trying to get one up to now. It's the last.
All right. We thank all our media colleagues for their questions and for participating in this media update. We're going to go to our second segment now, which I turn over to Minister Tufton.
All right, thank you very much. So we're going to move quickly into COVID conversations, really looking at the numbers behind the numbers. We have 3 quick interviews that we're going to be doing. Firstly, an update from Mr. Fabian Brown, who is the operations man on the ground at Baye Principe. We have had some issues in the past week. We've tried to resolve those issues and wanted to get an update from him. Plus, the Baye Principe is going to be used for a number of other persons going in from the Adventures of the Sea Royal Caribbean. Mr. Brown, are you online?
Yes, yes, Minister. Good evening.
Hi, good evening to you. Thank you very much for coming on. For briefly, tell us now what's the update, what's the latest at Baye Principe. I know you're giving an explanation from management's perspective. Give us your assessment.
Well, first of all, Minister, I must commend the government for the initiative thus far and the fact that we had the opportunity to partner in this way to essentially save lives and to eventually have our economy open as soon as possible. We have provided rooms, as you're aware, and 3 meals per day. Not only is it that we're providing rooms and 3 meals per day, but we have also added to all of that an attention to the mental health and wellness of the persons in our facilities. Our entertainment team provide daily activities, and this past weekend, for example, we would have had one of our own team members, who himself is a minister of religion, providing spiritual wellness to the persons in the facility. We also provide on-property transportation just to expedite movement and the processes, and just to ensure that the persons are as comfortable as possible. Our team of housekeepers, chefs, the entire team of staff that has really come out, some intermittently and some consistently, working around the clock, literally, to make the persons on the property and in-house here as comfortable as possible, albeit here under special circumstances, is really what we're about. So Fabian, as you mentioned a while ago, we are going to be providing another 400 rooms for our fellow Jamaicans coming in from the ship and otherwise, and we have made adequate preparations for those persons, including increasing our team members here on property as well.
So Fabian, quickly, I guess the cynic would say, what have you done differently from the last week when persons were disgruntled, not happy, complaining, lashing the government, myself, that they were not being treated well? What's different since that time to sort of correct that situation?
Well, Minister, as you know, part of in the partnership, we're talking about numbers because we prepare the meals are served, but there have been increased numbers in terms of the personnel, the support system on the property, both from the Ministry of Health side and indeed on our side as well. In terms of the variety and the spread of meals that we are offering to our fellow Jamaicans here in the house. That's another upgrade that has been done. Another significant addition is what I had mentioned earlier on. Our entertainment team have been doing a marvelous job in terms of engaging our the persons here in quarantine as they come out on the balcony, and they engage them in activities throughout the day. So much so that I can tell you the reviews that we have been getting have been very encouraging, to say the least. And we constantly listen to the reviews in order to be able to tweak and improve as we go along each day, because our mission is to really offer the support to ensure that the persons in-house are as comfortable as possible, because what we're trying to do is to be a part of the solution, essentially.
Basically, what you're saying is that we have added more people, which I've said publicly. You've adjusted the variety of the meals. You've added entertainment and some amount of spiritual support, and therefore, and that has helped or made persons more comfortable in their surroundings.
Absolutely, Minister. I think even that the engagement that we have on a daily basis, that has been a significant inspiration to the process, because we can well appreciate if it is that you're locked up for 14 days, albeit on a beautiful property in lovely rooms, you are going to get a sense of fatigue and you wanna leave. So if you are engaged, your mental space will be much different. So, I mean, I really want to give a big shout out to our team members, from the housekeepers, the chef, the kitchen staff, the ground staff, the technicians, everybody who has really been putting their shoulders to the wheel and making a significant difference for our fellow Jamaicans that are here with us. Our mission is to be able to see whether or not we can add to opening the economy very quickly and get our own sector, the hotel sector, back on the road. We're in the business of hospitality, and that's what we do.
Okay, thank you very much, Fabian. Keep it that way. We have a lot more persons coming in, Jamaicans, and we have to ensure that all are treated well. So we anticipate a continuation of the relationship. And I want to take the opportunity of thanking the Baye Principe for taking on this task. I think it's very important, and Joel, and the Sandals Group also for that facility in Montego Bay, and others. I think that we could not do it without that kind of offering, because only the hotel business has this type of room numbers and the facilities that could accommodate the institutional quarantining. So we appreciate it. I think the government appreciates it, certainly the people of Jamaica. Thank you very much, and we will continue to work together. Okay.
It's a pleasure, Minister. From the Pinera family to the local management team, it's a pleasure.
Okay, thank you very much. Can we go now directly to our next person? You're trying to get them online, right? All right. So the institutional quarantining arrangement is important to the COVID response, has been important to the COVID response. As we have said, over time we have to move towards the home arrangements. It means that the field operatives, the community health aides, public health inspector, public health nurses will have to work to examine these homes. So there's a lot of work involved in that, to determine appropriateness, to give appropriate guidance, to do follow-up and checks. We do work with the constabulary and the JDF where necessary to help in that regard. But the new norm that we are working towards is going to require personal responsibility. It's going to require an understanding and appreciation for persons to secure themselves, and if they get COVID and are asymptomatic, don't need hospital care, they're going to have to stay at home. And that is going to be very critical in order to manage the spread, or to prevent or avoid the spread. And that is the new narrative, that everyone counts, and it requires all on board to make the process work. Okay, as I had said earlier, we are going to do a quick discussion with a very significant person on the Royal Caribbean Adventures of the Sea. He is Mr. Clunis Daly, and he is the hotel director of a significant position. He has agreed to be identified, and guess what? He's a Jamaican who has worked for many years in this field, and who is going to give us a perspective. Mr. Clooney, welcome.
Thank you very much. Glad to be with you.
All right. The first thing I want to ask, first of all, I want to thank you for coming on the program, COVID Conversations. You're being listened to across the country and perhaps across the world on Twitter and Facebook and all the other social media platforms and mainstream media. I'm sure Jamaicans are curious to find out what parish you originate from, a little personal stuff, and how you got into the cruise business and how long you've been in it, and what does your substantial title mean, hotel director?
Okay, well, actually, I'm from the parish of St. James. I started with Royal Caribbean 1985. I worked my way up through various ranks within the hotel structure on board. And I've been now hotel director for over 20 years. And my position really on board the ship is I administer and direct the hotel operation vessel, just to ensure the company and the department and ship performance objectives are met. I have a number of managers. I oversee the entire operation, which consists of food and beverage, housekeeping, guest services, financial operations, facilities management, the entertainment areas, human resources, training and development, IT operation, casino operation, and all the other revenue streams that we have on board. So that's what I do on a daily basis, and I continue to say this over and over again that with Royal Caribbean, it's a great company to work for, and if you work hard and you play by the rules, you will be able to achieve your goals with this company.
So, Mr. Clooney, I think it's fair to say that you are the big man on Adventures of the Sea. You are the manager. You're equivalent to a hotel on land manager, with awesome responsibilities. Correct. And I want to commend you as a Jamaican. You carry the flag high, obviously. 35 years is a long time, and clearly you have demonstrated what it takes to command literally a floating village. What's the capacity of the Adventures of the Sea, if you don't mind my asking? Numbers, that is. How many?
Well, we have 5,200, 4,000 guests, and 1,200 crew members.
Okay. And currently you have 1,200 crew members and 1,044 Jamaicans. So you're about half your capacity now, or thereabouts.
Yes. Yeah, that is correct. We have a total of 1,321 crew members currently on board.
What is the nationality of those crew members, if you don't mind my asking? I know the Jamaicans, but beyond Jamaica, is it all?
Well,
yeah,
from all over. We have 38 different nationalities on board, from Argentina, Belarus, Brazil, Canada, Dominica, the United Kingdom. We have Indonesian, we have Mexicans, Indians, U.S. citizens, people from Ukraine, Russia, Sweden, Peru, Philippines, Poland, Romania.
That's a
all
lot.
Over. So altogether, it's a wide mix of nationalities we currently have on board.
So tell me now, the COVID-19, as you've been going along very well as an industry, and then COVID-19 strikes. Just a general question, how has that affected the industry generally, the cruise industry, and maybe your particular vessel in particular?
Well, it's like I mentioned earlier, it's unprecedented. It's an unprecedented situation, which really had a global impact, and especially our industry, the cruise industry. But one of the biggest challenges I've had since this pandemic struck was the repatriation of our guests and crew. And equally important, the ever-changing circumstances of the travel restrictions and shutdown globally have been extremely challenging for us to navigate, from country to country, where borders are closed, and we're trying to get both guests and crew home. It just posed a significant challenge to get that done. But getting our people home obviously is our top priority right now, and I have to say that we're finally making some progress, and we're very thankful to the government of Jamaica for their partnership and cooperation to bring home our Jamaican crew. and we do understand the obligation they have to follow in a way that has the best interest of the public health for the entire country.
I wanted to.
Sorry.
No, I wanted to go there a little by asking the challenge that you have as it relates to Jamaica is not just a Jamaica challenge. You have 38 nationalities on one vessel, and I'm therefore assuming that the coordination to get all of those nationalities to their respective destinations is equally challenging. Just wondered what your perspective is on that.
Yeah, well, it's a bit surreal, I have to say. We have 27 ships in our brand. We have many different brands, but just within the Royal brand, we have 20 ships, and you should see the challenge to get all the ships together, to offload crew members from one ship to the next. Because what we're doing now is the ships are taking people to their homeland. Obviously, with the approval of the respective governments, but it has been, like I said, extremely challenging to get everybody together from the various ships that they're coming from, getting them on one ship and bring them home. That process was tedious. It was challenging, and but I have to say, just the partnership with the various governments around the world make it worthwhile.
And the concern that governments have, is it fair to say that there is an understanding on the part of the cruise lines and hopefully those wanting to go home, why those concerns may be valid?
Oh yeah, definitely. Again, getting our crew home safely has been our most important priority, and we're attending to all their physical and mental needs of the crew. And what we have done, we have ensured that every single crew member stay in a single guest accommodation. We have provided food, snacks, and trying to keep their spirits up. And it's just trying to really make sure that the anxiety due to the uncertainty of the situation is dealt with, because we have a lot of crew members, not only our Jamaican crew members, but our crew members from all over the world. The anxiety, it's causing this mental stress over time. And throughout the process, all our ships have been following strict medical protocols to ensure that we contain the spread of any potential outbreaks. The protocols include quarantining and single cabin. We do an evaluation of crew twice a day, where their temperatures are checked by the medical team, and we're just working around the clock to make sure that our crew members are repatriated and get home safely.
All right, so I'm going to ask you the final question, but before, just to say we're happy you're here now, and we certainly look forward on land from public health and the government's perspective to start processing tomorrow morning, and of course to bring some relief as it relates to that. But I accept the explanation that this is a global issue and it's certainly affecting all countries of the world, and it must be quite challenging. But let me ask you, given this experience, what do you think represents the new norm, the new normal? A term I've been pushing now, living with COVID. How does this new normal, you think, in your view, likely to affect the cruise industry? What are some of these changes that you think may be necessary given the fear and the concerns around the coronavirus, COVID-19?
I've been giving this some thought probably a month ago. When we return to service, I think we will be sailing in a changed world for sure. I think how well we anticipate and solve for this new environment will play a critical role in our keep of guests and crew. It's gonna be about the guests and crew safety and health. I think booking from the time of booking, there will be changes there, where even elderly guests coming to cruise on board our ship pre-COVID will have to present doctor certificate of their health to sail. I think our dining experience, there will be some changes around that in as it relates to social distancing, maybe more table for two and not large table. Our shore excursion with us packing a bus, for example, to go on a particular tour. I think there will be changes around that. And just a higher portion of guests, I think, will want to book balcony rooms. And, we have a lot of rooms on board the ship with 4 berths. And I think that will be a thing of the past. And the newer ships that's coming out, I think, will probably have no inferior stateroom. So there will be, I think, at every food venue, there will be the hand wash station, and there'll be more focus on hygiene and health related situations. So yeah, it's going to be a changed world in terms, as it relates to cruising.
Thank you very much, Mr. Daly. The new norm does apply to the cruise industry. That's what I'm hearing coming from you, someone with 35 years. And in public health, we're saying on land, the new norm is also a reality that we will have to confront and deal with. Final question, as I did say the final before, but I cannot not ask you about the spirits of our Jamaican brothers and sisters on board as they anticipate coming off in batches of 200 starting tomorrow. What's the feeling? What's the mood? You're not coming off, by the way, because you're manning the vessel, right? So you take it back to port. But what about the others?
Yes, I will be on board, but there's a high level of great happiness just to be home, and our Jamaican crew members, majority are really looking forward to be home with their family. I think they're just longing to be home with their family at this stage, and they're I would say in a much better spirits today, much better mood, and just looking forward to be home.
Well, thank you, Mr. Daly. Just reassure them that the government understands the concerns that they have. We're happy to have them home, and we are going to do everything we can, as we have been doing leading up to this point, to bring them in and to secure each of them, their families, and the wider population. This threat is a threat to all of us, and we regret that we've had to put procedures in place, but frankly speaking, these are necessary procedures. So I'm happy that you have accepted that that is the case. Please pass on our regards to all who are on board, Jamaicans and non-Jamaicans. And again, I couldn't say goodbye without saluting you and your accomplishments. Very proud to be Jamaican and to listen to you give this interview, give honest, frank opinion about the new norm as it relates to the cruise industry. And we wish you absolutely all the best as you move to expand your horizons in this particular industry. Thank you very much. God bless.
Thank you so much, and take care. Thank you. Bye-bye.
So there you have it, a Jamaican who is the hotel director, the man in charge, bringing this vessel in. 1,300 crew members, just under 1,050 Jamaicans, explaining the nature of the industry, his long years of stewardship, and giving a frank account of the new norm as it relates to that industry, living a life with COVID that I think we all have to confront and deal with. On our part, we are going to do all that is necessary to get our Jamaicans off starting tomorrow, and we'll follow the procedures in the protection of our Jamaicans here and those who are coming off. All right, can we go to the very final? I know it's a little late. We're about 10 minutes over the time stipulated to close, but the government, through the Honorable Prime Minister, announced that we would not renew the work from home order come the end of this month when it expires. And therefore, part of that new norm is how do we now cope in a world of work that requires normal standard operating procedures of persons going into work, recognizing the risk of COVID, and what are the areas, the issues that have to be confronted in this new norm. And so we decided to ask Dr. Patrick Sterling, separate group HR manager, to give us quickly his view, given that he's a major employer, as to what this new norm may look like and how he intends to cope in a world of COVID-19. Dr. Sterling, how are you?
Hi, Dr. Tuffin. Good afternoon. I'm fine. Thank you very much for the opportunity.
No, man, not at all.
And,
thanks for coming on.
Good night to your audience. I'm not able to see everyone, but hope you're hearing clearly.
Right. No, so let's get right into it, Dr. Sterling. So the government has said the new norm will begin June 1 in terms of working from your workplace as opposed to from home. What in your view are the issues that will have to be considered, and maybe some of the issues that you are already putting in place as a major employer?
Right. So out of this experience, we've had so much learning in terms of a new work arrangement. First of all, in terms of our environment, I think employees have now come to a greater realization, and our employees have already realized, because we work in a food establishment and we were committed already to ensure we have a safe food environment. But this scenario has now driven home more forcefully to us that we have to manage our environment from a cleanliness standpoint, from being mindful of the people with whom we work, from being mindful of how you conduct yourself within this space vis-a-vis outside. So I think there's a greater understanding and appreciation for hygiene and self-management, even as we have to live with this virus. And as you know, it's our behavior that is in context right here. So I think that's going to be a critical part going forward in terms of how people have now seen themselves operating in this space. Yeah.
Okay, and the procedures, have you started to think about the procedures and what you may want to put in place, or you're not there yet?
In terms of just keeping the environment safe?
Right.
Well, we're putting all the procedures. In fact, it's going to be difficult to backtrack, because the procedures have worked very well, and many things are going to become the norm. In fact, some things were already the norm in our factories. Washing of hands, for example, covering up the head, and ensuring that your factory garb is not tainted in any way outside. That had been the norm, and it has been driven home. For the offices, it's now become a new norm. As you know, we have to certify all our employees with food handlers permit and all. So they've gone through the training. So the new norm is going to be cleanliness of surroundings. Issue of social distancing, we are coming back now, and we have to now begin to reorientate our employees to share space, but share space and be mindful of the likelihood of a spread still. So we can't crowd people back in. So we might have to continue working remotely. That has its upside as well. So quite a bit of things that we have to work on in tandem to get people back to work and to reorientate them to what's going to be the norm going forward.
And my final question to you, Dr. Sterling, and thanks again for coming on, is do you think that Jamaicans, and I guess through your lens of the people you deal with, appreciate the necessity of the changes that may be necessary or are necessary? And if not, how can we try to encourage a better understanding and a call to action so that persons recognize that what we're doing is not an attempt at depriving them of what they're accustomed to, but rather an attempt at giving them added protection against a public health threat?
Right, so there's a mix. There are many employees whose livelihood and welfare depend on the strictures that we've put in place to protect them from themselves and to protect others. There are other persons who see that as an inconvenience, so they'll break the rules. I've gone around and seen people without masks in places that they ought not to be without. And it's this larger number of persons that we now need to reach out to. So public education, so drive home the fact that their behavior is going to have a longer term negative impact on the country as a whole. But I think most Jamaicans have woken up to the reality that their behavior, if not kept in check, is going to impact negatively on other people. And so our focus now is for those persons who have not yet had that realization.
Mm-hmm. Well, we certainly look forward to the collaboration between the government and the private sector. That is now taking
Certainly
place.
Look forward to that, yeah.
That is now taking place. We're doing a number of protocols. We're working with the PSOJ, with the Jamaica Chamber, the Jamaica Manufacturers Association, and the idea here, the BPO space, the idea here is to develop together the new work space, the new work environment with a public health focus as we seek to overcome the threat of COVID-19. We do not want Jamaicans to be complacent, even though we believe we are making progress and have made progress. We want Jamaicans to get back to life, to earning, to economic activity, to social activity, to play, but we want that to be done in the context of a recognition that a threat, COVID-19, exists and will continue to exist for some time to come. That is why we say it's really a new norm. And yes, it might not mean a lot to people. We've shortened the term by using the two words, and people can interpret it any way they want. It's really about communicating and getting that message across.
Yeah, definitely. And I'm sure the separate group, my team, will willing to share our experiences with the rest of Jamaica. Because we have learned a lot, and we're willing to share that experience.
Thank you, Dr. Thank you, Dr. Sterling. Appreciate it. Thanks a lot.
Yeah,
just to say before we close that in regards to the question that that was asked about the telethon, the telethon did take place. They raised $50 million, and funds are being held in an account specially set up by the NHF to purchase PPEs for healthcare frontline workers. United Way gave $4 million to the fund to buy PPEs for the JCF, and yes, the NHF continues to source PPEs. So I am assuming that those funds have already been mobilized. I can get better particulars on it, but the funds that were raised, $50 million, and were placed in a special account to deal with that. That's the information coming out of Minister Grange's ministry, and it certainly indicates that we are working as was promised. All right, I want to thank those who are listening for joining us. We've been a little lengthy this evening, but I think the discussions were useful. Thank those who held on. Thanks to the team, the public health team, the permanent secretary, the CMO, and to those in the field, those who are working at the labs, at the control center. Just to recap again, 26 more Jamaicans recovered in the last 24 hours, 32.3% recovery, 1.7% death, and we are seeing some additional positives, 9 additional positives in the last 24 hours. That brings the number to 529, and we have done some 9,021 tests to date. Thanks again, and we're going to close this evening with a short video, 2 short videos, and the theme of these short videos is the Everyone Counts, Together We Can Beat COVID-19. It's been the theme of the discussions here, and it will have to become a part of the narrative. The new norm means we all have a role to play, and we encourage Jamaicans to play that role. Short video. Thank you very much. Good night.
Everyone has a role to play in this fight against COVID-19. You, like me, can be young and healthy, but we can affect others. So, keep your distance, wash your hands, use hand sanitizer, and of course, before you leave your house, put on your mask.
Look here, no one come crowd up my shop, you know. Stand at least 6 feet apart. And if you're coming in, please sanitize your hands and wear a mask.